Howdy. Welcome to Healthcare Ain't Easy. Thanks for joining us today. I'm Chris Matthew, and I appreciate you sharing time with me and my guest today, Richard Blanton. As we continue to explore the challenges of healthcare and the healthcare industry is facing, we know that there are many things we have to figure out. But we also know that communication and collaboration are among the first steps for a successful outcome for all of us. Rich, thanks for joining us.
Glad to be here, Chris.
So, Richard Blanton is my partner and the CEO and co-founder, founder of Sniffle, Sniffle Health. Rich has been a CEO with global experience, and it is incredible, actually, for me to be able to sit shotgun alongside you, and I learn a tremendous amount on a daily basis. But Rich is also a serial entrepreneur. He's had lots of business experience around the globe, as I mentioned, but 5 startups, 5 successful exits, one of which went public. Batting 1,000.
Batting 1,000.
That's pretty good. Let's hope that we don't mess that perfect record up here at Sniffle.
No, we're not going to. I think Sniffle's, it's time for a product like Sniffle and an approach that, we've come up with to address the needs of the healthcare community and leveraging technology that otherwise wouldn't be available to the consumer or to the healthcare community. So really excited to get Sniffle into the hands of our doctors and our patients.
Yeah, I completely agree. I think, well, I don't know necessarily all of your previous endeavors, but I think that we have the opportunity to create something that is bigger than either one of us could have ever imagined it to be.
No, I agree. I think the most important thing is, virtual care as a whole is a viable means of rendering and receiving healthcare. The challenge has been, it's really been suppressed by telemedicine service providers, which is not good for the industry as a whole. It really doesn't bode well for the credibility of the modality, and it really excludes a lot of people that don't have a membership per se, or aren't part of an organization that's contracted with one of these service providers. Albeit they've done us a great justice in making everybody aware that virtual care is a viable means of getting treatment.
Absolutely. And we're going to dive into more of that here in a little bit. But before all that, give us the highlight reel of where you're from and what experiences helped shape you to who you are today.
Okay, to be honest, if anybody, I'm from Ohio. I'm a Buckeye. I went to Ohio State. My dream was to be a professional baseball player.
Okay.
And did well at it, was drafted, and continued to play amateur baseball later on, but spent 5 years in the Air Force. And that was probably the most enjoyable, most enriching 5 years of my life. It was, I traveled and lived abroad.
Where?
And I was in Guam for 5 years.
Guam.
Actually 3 years, not 5, 3
Okay.
years. Interesting job I had there. I can't share a lot of the detail with you, but it was pretty fun.
Yeah.
Beaches, I was on the alert force. So I was on 24 hours and then off 72 hours. On 24 hours, off 72. So I got to the beach a lot.
Yeah.
A lot of diving, a lot of fun.
So growing up in Ohio, military background, pursuing the Air Force, were those things that your family had done?
Yeah.
And
Exactly. So it was something that was part of a family tradition. My grandfather, father, brother, me,
Yeah.
that was, that's just what we did. And we made our commitment and gave our service. And some of them stayed in a little longer than was in for 5, and I wanted out to see the rest of the world.
Yeah.
On my own ticket.
Well, thank you for your service. So then the life of business and the life of being an entrepreneur, where did that come from?
Well, I don't know, just restlessness. Seeing opportunities out there and understanding there's always a better way to do something, or there's a need that needs to be filled that's not being filled with the right stakeholders in mind. And so I've been successful in doing that. So starting in the beginning with supply chain really was the ethos for where I started the idea of delivering software through the internet versus the internet being a toy. That was an interesting part of my life where I was the youngest CEO of AMR Services, and we had a huge infrastructure of warehouses and call centers, and we commercialized with the growing of the internet and e-commerce, and that was really an exciting time. That was an exciting time. We had just like now, we had a solution to a problem that empowered and enabled a lot of companies, a lot of businesses. So we integrated over 2 million square feet of warehouse across the U.S. We had 5,000 call center seats, had a browser-based OMS system, order management system. So if you wanted to sell something on the internet, it was you just plugged into us.
Sounds like you're talking about Amazon.
Yeah, well, that was funny you should mention. I had a call one day, and I'm in my office, and my admin's in there with me, and it was funny because I needed a new phone system. We outgrew our phone system in like 2 months. So I called the phone company back, and Executon was the name of that company, and I said, "Hey, look, can you give us a bigger one? Take this one back."
Real quick, you had to call a phone company to buy phone lines?
No. I had to call Executon, the people who sold us the phone system, the
Okay.
ACD. So the answer to me was, "No, we'll give you 10 cents on the dollar, but we do have somebody that outgrew their system. You're welcome to call them to see if they'd sell it to you because they're going to buy another system." I go, "Okay." Called him up, got him on the phone, talked to him for a few minutes, and said, "Yeah, I have 75 stations. Happy to sell it to you, blah, blah, blah." We chit-chatted a little bit, and I finally asked, I said, "Well, what is your business model? What are you doing? How are you growing so fast?" He goes, "Well, we sell books online." I said, "Well, that's good. It's great." I hung up the phone, and I looked over at Lori, and I said, "Man, what a dumb business model. And Amazon, what a dumb name. That's not going to go anywhere." But as we all know.
So you didn't get that one right, but you got 5 others right.
Yeah.
So what was the process of getting into these different global organizations that kind of led you to where we are today?
Well, with the global organizations, I was hired as their CEO. We had about $13 billion under assets under management, $13 million in assets under management, and they needed more representation in North America. So they hired the good old American CEO to bring them into America a little stronger. We had offices in London and Mumbai, and that organization is a conglomerate. They have interest in hospitals, 8 or 9 hospitals. We had an interest in Nissan. So there was a very interesting job. The intent here in North America was directed towards, at the time, was an outsourcing, the labor arbitrage back in India. But and then with Indra Systemis, I took over North America for them with the relationships I had at Bechtel and Accenture. It really helped us with penetrating the energy market here, deregulated energy. So.
It's always interesting when we talk about that experience working for a company based out of Spain, and what would happen every August?
Well, every August was everybody had to go on holiday. And it didn't matter what you were working on. It really didn't matter if you were working on.
You're about to close the biggest deal in the world on July 31st.
Oh, yeah. And we're out of office. It's holiday, and they take it serious. It's 30 days off. And the work day there in Madrid, when I'm in my office, we eat lunch at 2. We come back at 4, 5, work for a couple more hours, go home, and then go to dinner at 10 o'clock at night. That went on for months while I was there. It was just a different lifestyle. But Indra, a great company. It's the kind of company you'd hire when cost doesn't matter. You just need it done right. Big in defense, simulator systems for the defense system and for nuclear installations across the globe. So I handled all their M&A. and brought him into the North American energy market, a deregulated market, was recently deregulated, and renewable energy too. That's a very interesting market. It was very interesting for me to understand what a credit zone study was, and to understand, what the cost of having, how many megawatts or a megawatt put up on a tower. And T.B. Pickens got involved and kind of shut us down a little bit at that time. I'll give you a little story on that later, but it was interesting. It was fun.
So those experiences, how do you go from working in London and New York City and India and throughout Spain and Madrid to coming up with Sniffle? There's a lot of points there that don't seem like they follow each other.
Well, I'll give you, the truth is, with Indra, I wasn't busy enough. Just didn't have enough to do in front of me. I mean, we would land, $100 million project for wind farm, and that's a 2-year cycle. And there's not much you do between now and the time we go to implementation of that, or an ETR, energy trading system, out at PG&E. Nothing we could do, nothing I could do for a couple of years. So I played golf a lot, to be honest with you. And I felt guilty because they're paying me a lot of money to play golf. But really, having resources in Spain, and one of the barriers was language, only sufficient enough to take on the projects that we had, put me on the bench for a little while. So all I could do is play golf. And I started consulting. I was consulting with a firm, an insurance company who had gotten in crossways with insurance brokerage firm, got crossways with some of the underwriters for the practices. And while I was there, they mentioned this back in 2011, mentioned this thing called telemedicine. I thought, what's that? Kind of a quirky little name. I thought, what is telemedicine? Well, you can have a doctor visit over the phone. And I said, really? And I mean, a real visit? Yeah, write prescription, the whole thing. That caught my ear. So I called New York, some guys I knew that were investment bankers. And I said, about telemedicine? Oh, man, yeah, it's a hot thing right now. We're throwing money at it left and right, but primarily device stuff. They were device companies they were funding. I dug into it a little bit more. I really thought that was a real breakthrough, to be able to receive viable medical care without having to go to the doctor. That's unique. So that's when I got involved with it, and tried to acquire a firm here in Dallas called Ameridoc, and we went through a year's worth of due diligence and negotiation. I got a chance to look up under the hood at Teladoc also, how they did the business. All along, though, I'll be real honest with you, I really couldn't palate the idea of a membership program for healthcare. It just really, and to this day, it still bothers me.
Why?
Well, if I need to see a doctor, I shouldn't have to pay a fee to a group, to a third party, to have access to a doctor that'll see me. A doctor I probably don't even know, or I know they won't know me. And just that whole concept of healthcare, it was kind of an anomaly to what healthcare, meant to me. And to most people, I think. When you think of going to the doctor, you have a picture in your mind of seeing, a doctor you're going to see again, maybe.
Your doctor.
Your doctor, yeah. Exactly. So, at the end of the day, it was an opportunity. I jumped in with both feet. I called some friends in Madrid. We brought some money in and tried to acquire Ameridoc. And long story short, the owner's wife didn't want to sell. She had a little bit more pull, we thought. And then Teladoc ended up buying them. So a lot of moves were being made back then.
So that's pretty beneficial.
Yeah, huge. I mean, the benefit that Teladoc and Doctor on Demand, these other companies provided can't be ignored. I mean, they've done us a good job of blazing a trail and creating awareness, albeit they stuck to their old insurance models, which has always been. It's why I don't use the word telemedicine. I only use it when I speak about those folks, because virtual care is it's an ethos, it's an ecosystem. It's where you go to see your doctor. Anyway, long story short, went through a couple of consulting gigs with some folks trying to start telemedicine companies up because I really liked it. They all wanted to do the same thing. They all wanted to offer, access to a network of doctors that would do consults for $20. And they'll see any random physician or any random patient. Patients seeing random doctors. They all want to do the same thing, and they're out there a dime a dozen. Eventually, I founded Sniffle. Wanted to do it and put a spin on it, and not a spin, but a business model behind it that really isolated the true stakeholders and put them in play. So I have patients and doctors in this model that benefit each other, and not some third party getting some membership fee so you can see the doctor and putting doctors behind a paywall, if you will. Just a pet peeve of mine. I think doctors should be accessible to everybody, and they should be able to render their care when a patient needs their care, not if the patient's paid their membership fee. So,
well, I completely agree with you. When we first met about 3 years ago, when I learned about the business model of Sniffle, I immediately recognized it's a winner, because I see that you structured this to be able to serve patients first and physicians and clinicians. And by doing that, in another episode, we had a benefit broker here talking to us about how many layers of people are in between the doctor and her patients.
yeah.
And it is unbelievable how many people are clawing in here, taking a piece. And unfortunately, some of these other business models, while I agree with you, we are grateful that they blazed the trail. They allowed telemedicine and telehealth to get out there.
Yeah.
But the business models are still flawed. And this being able to really support continuity of care, physician and her patients coming together to maintain that relationship and that connection. I think about my wife and our boys, and my son had a pediatric appointment this morning. That pediatrician, she's been with our boys literally from the day they were born.
So you think of when you're taking kids to the doctor.
That's who I think of. It's who my wife thinks of. It's who our boys think of. I mean, it's and she knows of this life cycle of them because of over this continuity of 9 and 7 years, she has been seeing and watching them develop and grow. And that is priceless for us, because when we think something is off, she's the person we can turn to that has that depth of knowledge, not just a one-time incident, right?
Yeah.
And that's really meaningful.
The history. How did that antibiotic work last time I saw him? Is he getting the fevers back? Those are the things that are important. I feel the same way. When you think about seeing a doctor, you develop a relationship with them. That's what healthcare is. It's about relationships. That doctor gets to know you. And sure enough, in virtual care, there's going to be that time when there's going to say, hey, I want blood work.
Yeah.
I need you to get a lab done. But for the most part, 90% of our visits are going to be colds, rashes, flus, things you need to take care of. Beyond that, we've provided in Sniffle an opportunity where people can diagnose themselves in the app, which with regard to, our, mission statement, if you will, our why, is bringing technology to the fingertips of physicians and patients and enabling them to interact in a way that creates efficiency and better health for everybody. So we don't look at a means of, well, let's charge a membership. Let's be one of the stakeholders in that relationship. If we provide value, we'll make our money. We'll be paid. So we offer that technology and a little deeper level of participation on the patient level if they choose to use our technology to access other benefits that are built into the app. I mean, an RX discount card. Nobody knew what that was. Discounts on RX, the markup's crazy. They've got a lot of wiggle room in the pricing.
No doubt.
So GoodRx comes out with an RX discount card. It's like this revelation. Well, little do you know that 20 years before GoodRx, there were RX discount cards out there you could get. But if you didn't have the technology or the knowledge, you wouldn't know about it. You would only acquire that discount card through some other membership program that you might have to buy into, AARP or something of that nature.
Right.
These are the things that I think Sniffle really brings to the consumer, is visibility to things that would have never been exposed to if it weren't for the technology. And
Yeah.
you can open up our app and you can find a dentist that will provide a teeth cleaning for $35. And these are tier one dentists. This is the dentists that have decided to do it cheap. These are ones that have, agreed and have a contract, a payer contract with Aetna. They're the,
It's the real deal.
Yeah, the real deal. So you go there and but you wouldn't know without the Sniffle app if you go in and you had your teeth cleaned for $35 or a teeth whitening for $150.
Right.
It's part of the consumer ethos now too. It's mobile first. Go to your phone.
Yeah. I'd love that concept. Phone first, right? And we talked about this with our team internally. Mobile banking, when it first came out, seemed like a ridiculous thing. Like, no, I have to go sign the back of my check, and they have to actually scan it. And then it was like, take a picture of your check. What are you talking about? And now the idea of, phone first banking is, I don't go to the last time I filled out a loan application, it was through my app.
Yeah.
I got approved instantaneously, and the cash was wired the next day.
Yeah.
That was the extent of it. And I think that's where healthcare is going. Healthcare ain't easy, right? The ain't is AI.
AI.
We're using AI. We're bringing technology together to help people do more with less. And I think that's where healthcare has a tremendous opportunity.
Absolutely.
We can help people lean into a phone-first healthcare system, an ecosystem. And I'm really proud that our team we built this incredible platform to help create this positive impact. What I want to ask you about is, who do you believe is best served by AI and technology and solutions being applied to healthcare? Who can be best served by that?
Well, who wouldn't be best served? Honestly, it's going to be part of our life. It's here, regardless.
So everyone.
Everyone, everybody. So there's a lot of apprehension, a lot of fear, and rightfully so. I mean, it's gunslinging out there. None of it's curated. You can go out there, you can put lemon meringue pie, and you're going to get something back, and it's going to be pretty doggone impressive. Unless you curate it, you use the AI engine and you purpose it for something, it is really nothing more than a very underutilized advancement in our technology, in our world today. So, our goal was to give consumers purpose for artificial intelligence, not to give them a link to a ChatGPT. Ours is not ChatGPT. When you go into our app and you want to get a diagnosis off our app, it's curated data. It's going to a large machine learning database to pull from 14 million consults that have been done, encounters that have been done regarding the symptoms that you have. So it's not a toy. It's not something that
This is not Dr. Google.
Dr. Google at all. And it gives you a diagnosis, an diagnosis, if as we term it, because a true diagnosis really cannot be provided other than from the physician. And we'll get into that, and you have a good way of putting that. But from our perspective, giving patients visibility to their symptoms and what's happening in their body, and I'm talking about everything. If you have appendicitis, this app will tell you you have appendicitis, and it'll be correct. It'll be right. It's not. It'll tell you to get to the ER. And when you get to the ER, the doctor's going to go, yeah, you have appendicitis. Good thing you got here.
Yeah. There's a lot that technology is going to help us do, and it's early. We're really early. I share this often. The first time the stethoscope came out, the first time a lab test came out, the first MRI machine, everyone was a little skeptical. What in the world? Now it's part of everyday medicine, and I think that AI and advanced technology is gonna find a way. We're gonna create phone first healthcare in the coming future.
It's just a kind of analogy. Back in the day, with AIM, I looked at the internet as a tool to disperse software, to distribute software, and to use and put browser-based systems up to manage supply chains. But the internet was to everybody else. They hadn't found a purpose for it yet. And great, it's entertainment.
It was AOL chat rooms.
Yeah, right. They could listen to music.
Right.
But finding purpose for AI right now is and curated purpose is an opportunity for us right now in the healthcare space. So.
Yeah. All right. So I want to, final question. Chris Schembra is a fantastic author, Wall Street Journal best-selling author, in fact. He's got this book that I really appreciate called Gratitude and Pasta. And he puts on these incredible experiences and he brings people together and he asks them this one question, and it is really transformational what people can open up to and share when they answer this question. So the question for you, Rich, is...
I'm on the spot here now.
And you are. But this is an easy question. You got this. Right. If you could give credit or thanks to one person in your life that you don't give enough credit or thanks to, who would that be?
My dad. My dad. He's, he always asked me why. And he always gave me a platform to argue. If I didn't like it when I was a kid, he would, and I did the same thing with my children. And they turned out great. But I think always asking why. And if it was a no, I was allowed to ask why. So that, and, my church. Yeah. You stay grounded, you stay focused. Always ask why, and don't be afraid to ask the why. I think it helps.
Yeah, I think asking why, especially when you're an entrepreneur. Well, you're batting 1,000. But I've had lots of losing endeavors, but asking why is a really resilient way to figure out how to get it right the next time. And I think that's fantastic. Well, I'm really grateful for our collaboration and our partnership. Thank you very much for tuning in to Healthcare Ain't Easy, and we'll chat soon.